This is video 17 for the skeleton, chapter 7 and 8 for anatomy and physiology. In this video, we're going to start looking at the appendicular skeleton. So if you recall, this involves the upper and lower limbs and the pectoral and pelvic girdles. So the girdles are the links between the axial and appendicular skeleton. So we're going to start with the pectoral girdle. And that is going to involve connecting the arms to the axial skeleton. So the only articulation, like I said in our last video, is between the clavicle and the manubrium of the sternum. So that is the only thing that connects the pectoral girdle and your arms to your entire axial skeleton, is that articulation. So we have two scapula. So we have the scapulae, which is plural, and these are going to be our shoulder blades. A flat bone, and we have some features on them that we are going to discuss. And we have the glenoid fossa, the acromion, the coracoid process, and the scapular spine. The glenoid fossa is a depression in the bone, in the actual scapula, for the glenohumeral joint. So this is the articulation, not to, but with the humerus, or the upper arm bone. So this is going to be a pretty big joint. It is a ball and socket joint. It offers a lot of range of motion. The acromion is located on the top of the shoulder. This is the articulation with the clavicle or collarbone. This kind of forms the point of the shoulder. So you can actually feel this up on the top. It is kind of pointy and hard right at the top. If you start rotating your arm around, you can feel it doesn't move, but you can actually feel a little depression beside there where this glenoid fossa is going to start. And then the coracoid process is a rather large muscle attachment site for large muscles, and that is going to be for the pectoralis major muscle. So the pectoral muscles, which we know are the muscles that comprise most of the chest, and we need a very strong attachment site for that. The scapular spine is posterior, so it's on the posterior surface of the spine, and it is going to be for back muscle attachments. And we'll take a look at all of these on the diagram. The clavicles are your collarbones. Again, we know that, thinking back to last chapter on bone, the clavicles were formed, one of the only bones formed by intramembranous ossification. And the clavicles are not fun bones to break because there's not a whole lot they can do for a broken clavicle unless it is shattered. They might have to do surgery to put it back together. But a lot of times they'll just put your arms in slings or immobilize your arm because it's hard to immobilize this area. But we do have joints, and they are given names for what they connect. So we have the acromio, clavicular joint. So the acromion and the clavicle, so the shoulder blade and the clavicle are joined by this. And then we have the sternoclavicular. The sternum, and it is the manubrium of the sternum to the clavicle. So our diagram is actually going to have both the pectoral girdle and the arm bone, but we're going to just look right now at, here is an anterior view, a superior view, and a posterior and lateral view. So there's a lot of different views of this here. So with this diagram, we can see a couple things that we need to highlight. So right here is the clavicle. So you should know that bone. The sternoclavicular joint is right here. So it is this area right here. And here is the manubrium of the sternum. And you can see that we have a lot of ligaments because this is not a very movable joint. Here is a vertebrae, and this would be T1. And then this is the first pair of ribs here. So we have a ligament between the first rib and the clavicle called the costoclavicular ligament. Then we have a ligament that goes between the two clavicles called the interclavicular ligament. You don't need to know those, but you can actually feel this right at the base of your throat. You can feel where these articulate, and you can feel this little groove right here. And if you move your head around a little bit, you might even be able to feel the ligament because it is not as hard as the sternum. This bone does not have much movement. Here is the acromion of the scapula, and then right here is the acromioclavicular joint. And there's a capsule of material around there that helps protect that joint. So this joint really doesn't move all that much. There's a little bit of give, but it's not a bone that moves. So this is more of a stability and a connection. So this right here is the only connective point to your axial skeleton, is this very small bone and very small surface right here. So this goes across the top of your shoulder, and then we have the acromion. So looking from the back down here, we can see the acromion kind of curves up around here, and right there's that acromioclavicular joint again. So this is a different view of it. Here is the coracoid process. So it is this part right here. And it's kind of hard to see that. I do have an actual, or I will have an actual scapula for you to see when we go over this in class. So it's a little bit hard to see, but this sticks out, and it is kind of looks like a bird head, if you want to think of it like that, where the beak is going to be where these muscles attach to that go across the chest right here. Here is the glenohumeral joint. So it is this area right here. And we said that was a ball and socket. So the glenoid fossa right here in this lateral view, that is going to be the ball for the ball and socket joint, or I mean the socket for the ball and socket joint. Here you can see a different view of the coracoid process. So here is our scapula. If we look over here at the posterior view, here we can see the spine of the scapula. So as the acromion comes down, it turns into the spine. And there's going to be a large number of muscles that attach along here, and the muscles are very wide and flat, but they help a lot with movement of the shoulder. You can get a little bit more of a view here of the glenohumeral joint as the head of the humerus fits into the glenoid fossa. This superior view up here, you can see the person's head is right here, But this is showing how that little joint right there on either side is the only thing connecting the upper arm to the sternum. So your clavicle, if you break it, you basically sever the connection between your arm and the rest of your body internally. And here is that acromion from a different point of view.